What do you think potentially some of the holdbacks some parents may have in engaging with you? Do you feel like there's some things that maybe they wait too long, or they're trying to figure out for themselves, or some internal pushback that they may have in engaging with you? Can you talk about that a little bit?
Yeah, I think what often happens is that when there are mental health concerns, we sit on it for a while. We're struggling sometimes for years until it gets to be too much, until it's affecting school, relationships, work, and then we seek help. And maybe that might be just maybe talking to a friend about it, maybe talking to your doctor about it. I think there's also still a stigma about getting mental health treatment, and a lot of misunderstandings about what that might entail. So it's understandable given so many side effects with medications that a lot of people are reluctant to take medications. But I think that that can sometimes hold people back by thinking that, well, I have ADHD and I don't want to take a medicine, so I'm just not going to get treatment for it. But I think we know now that there are other treatments for it. There are behavioral modifications, things that you can change in your environment. There are some supplements. There are some of those other holistic treatments that might give some benefit to some of the psychiatric symptoms. So I think that can be a major setback for people to end up seeking help from a psychiatrist.
Yeah, because that's what I think about when I think of holistic. I think of alternative options. Not so much in that people that are seeking to totally avoid conventional medical solutions, but that I think the world has changed a little bit, at least in the proactive side of things, right? Where from a proactive medicine standpoint, the holistics, I think, beckon to a space of people that are looking to do more for their family and so forth, or for themselves, and that overall wellness. I think they embrace that concept more. Have you seen that? What would you say to that from your perspective?
Yeah, I would agree. I think for example, when a child is struggling, it affects the whole family. It's not just that child doing poorly in school or having trouble with friends. I mean, it affects the parents, the caregivers, the siblings. It's really a whole family entity. So I do feel like people are more willing to seek help in different ways. And maybe that's through more alternative methods, and maybe it's more like traditional psychiatry. But I think people are more open to seeking out different options. And now we're having more and more research support other options too, that there are alternatives to improving symptoms.
I have a funny feeling because I understand the space, but yet there's still that blurry line that when you are not engaged with the provider, the difference between psychiatry, psychology, things like that, I think is a little confusing to people. What would you say to a parent who's trying to make that decision for themselves? Because I mean, this isn't, or is it, a primary care directive where they come through that side of the system? Did they come through conventional medicine and end up to you, or can they engage you directly, or how does
Mm-hmm.
that work?
Yeah, there's different ways to come to me directly. Sometimes, what I often find is that sometimes when parents have had their own experience with mental health, they might just contact me directly and know that, well, we're gonna kind of skip some of the middlemen involved and just seek help directly because they've had knowledge and experience with it. And sometimes, which is perfectly acceptable, to go through primary care or seek help from a therapist first. And I think that that can be very helpful for some patients as well. Ideally, things work best from what we know from studies is that having the support from a therapist in combination with a psychiatrist tends to give best results. So I get people from all different ways. I think I've definitely had patients who are just curious. They might come to me not quite sure if they want a medication or not, but just want to talk about it, see what the options are, and I think just doing the education of what works best for you and your family is really what's important.
So is that how they start with you then, or is that one of your recommended pathways? Is just to say, come in, sit down, let's have a conversation and see what's going on. What would you say to that person who's trying to decide right now? Is it that simple?
Yeah, I think if you're curious and if you feel like you're struggling and not quite sure what the next best step would be, it's always helpful just to have a conversation. I'm always happy to provide other referrals to people if we need other testing, if we need other labs. I'm familiar with therapists in the area, so if you feel like you're not quite sure what the next step is, I think just having a conversation with me can at least give you some information about what options are there for you.
Do they need, and do you provide a reciprocal connection with primary care? How does that work if they're coming in and communicating with you? How do you keep that connectivity with their primary care provider?
Yeah, ideally, it's best if we have a pretty open connection because they, oftentimes with families, they've been seeing their primary care doctor for many years. They have a very close relationship with them. They know them pretty well. And if they're managing some other issues, some other medications, it's always helpful if they come to see me that we make sure we're all on the same page, that medications are all safe to take together and family dynamics, if there's any concerns there, we just have that more collaborative approach. Same with a therapist as well. If you are seeing a therapist and are curious if you might need a medicine or might not, happy to have that conversation because usually your therapist has been likely seeing you pretty regularly, and they just having that communication with them can be very helpful for all of us.
What's changing in the environment right now for which you operate as a provider?
I think it depends on the age group. I do notice with younger kids, a lot of younger kids struggle with more of the ADHD issues and sometimes behavioral problems. I've seen, especially since COVID, with teenagers struggling more with anxiety and depression. And I see adults as well, and I think it's kind of similar, a little bit of all of the above. And I think there's a lot of different things at play that has just slowly been changing our environment over the years. I think COVID really affected a lot of people, not just emotionally, but the actual, we know a little bit more about long COVID and how that affects mental health. I think there's also a lot of pressure for kids in school, so it's pretty common during the school year, just with the stress of homework, oftentimes the stress with other kids, bullying, some more mental health issues come up. Summertime, it can bring up stress in different ways, but summertime can be a little bit more relaxing for kids. So it depends on the age group and kind of the time of year also, just depending on what people are struggling with.
Do you feel like the things that are creating a better educational environment for kids are creating a challenge for their mental health? I mean, it's pretty competitive out there. I mean, kids that are going into high school knowing that their end game is to get into a university, competition is insane right now. Do you feel like those are contributors to, I mean, obviously they are, but I mean, what are you seeing in that environment?
Yeah, I think, like you mentioned, high school kids getting into college, and I think I see it with a lot of really young kids too. We have a mentality that we just need to keep so busy and go and enroll kids in so many different activities, which can be very helpful for some of them, but for some of them can cause burnout and creates a lot of anxiety, especially at a young age when, I would say at any age, even for adults, we need downtime. We need calm, quiet space to just be with ourselves, be with our thoughts. And when we're constantly on the go, we don't allow ourselves to just sit with ourselves. So when feelings come up, when difficult situations come up, if we're constantly preoccupied with an activity, with stress getting into college, with our cell phone, we don't allow ourselves any space to learn how to deal with some of these emotions. So I think that the constant stimulation, overstimulation, whether you're 2 years old or an adult, I think has created an environment that almost facilitates anxiety and depression.
Is it, what would you recommend for families to consider proactively? Is there such a thing as a proactive need for this with kids going off to school and going through as much competition as they have just to get there? I mean, is there almost like a wellness check for this that people are missing? I mean, people talk about proactive healthcare, but what does that mean in your environment?
I think when it comes to children and families, I say there's no substitute for spending time with your kids, and that might mean maybe 10 minutes, just you and your child spending time together, especially if you're worried if your kid is having some behavioral issues or struggling with anxiety, depression. When you allow yourself the space to just be with your kid, no agenda, no time for lecturing, just maybe doing some activity together, coloring together, going on a walk together, you at least create this space where they can approach you to talk about these things. But like I said, if you're constantly stimulated and constantly on the go, if we've got our cell phone out, then sometimes we don't even notice that we're struggling until it's too late, or we just don't create any space for our child to approach us about things because they know that, well, she's got other things on her mind, I don't want to bother her. But as much as we think that teenagers don't want to talk to us, they do need us in different ways. So I would say a wellness check is to make sure you're carving out space. Even if you think that, like I said, even if you think that your teenager doesn't want to spend time with you, at least you're making yourself available for if and when they do.